I don't know, we have Toxinology, sea creatures. So wonderful Australia, where we have some of the most beautiful beaches in the world, but if you swim in any of them, you're probably going to die. We have tropical jellyfish. This is, at the moment, everything above Bundaberg is where you can potentially get tropical jellyfish. But as the seas warm, this is starting to move to lower and lower latitudes every time they measure it. So if you work in even in Brisbane, watch this space. This may be something that within your lifetime you'll see tropical jellyfish down that far. So if you have a jellyfish sting at the moment above Bundaberg, treat it like a tropical jellyfish. You want to remove tentacles by washing them off with seawater. If you use fresh water, it can make the nematocysts discharge more and inject more toxins. If you have vinegar available, rinse off the wound or rinse the tentacles or the area that's been stung, because that will also help neutralize the nematocysts and stop them from firing anymore. We don't put a pressure bandage on them because those nematocysts within the tentacles, if you touch them and add pressure to them, they fire again. So if you press them up against the limb with a pressure bandage, you're just going to inject more toxins. If you think it might be specifically a box jellyfish, so you're looking for these sorts of sting patterns, these horrible, very severe looking welts, as opposed to many jellyfish stings will just be very, very thin, maybe one red sort of squiggly line. If you're seeing that sort of pattern, you may be looking at a box. If it's a severe sting, so if the patient's starting to become very systematic, you're going to have to give antivenom. It's the only creature that we actually carry antivenom for in the ambulance. So we want to give 20,000 units, which will just be one vial. The vials come in varying quantities, depending on how many units they got. Depending on how the same amount of units will have a different amount of mils. So 20,000 units might be at 1.5 mil. Sometimes it can be as high as 4 mil. So if you have different amounts of fluid in the vial, that's totally normal. So you give a whole vial, which is 20,000 units, over 20 minutes. We use a spring fuser syringe, so it just gives it a nice slow push. If they've gone into cardiac arrest from a box jellyfish sting, you need to give 60,000 units quickly. So 20,000 over 2 minutes, and then just repeat that immediately 2 more times. The other type of tropical jellyfish sting that requires active management is Irukandji syndrome. Now, while there is a specific Irukandji jellyfish, they're very, very small, you can see up here. There are several species of small tropical jellyfish that cause Irukandji syndrome, so just for convenience, we'll call all of them Irukandji. Because they're so small, patients may not even be aware that they've been stung, or they may just think it was a bit of sea lice or something. And they can present, with 30 minutes or more after the sting. So it's not uncommon where patients have had a swim, gone home, and now at their house they start to get these symptoms, and it'd be quite hard. You need to be a bit of an investigative sleuth to draw that connection to the fact that they've been swimming in the ocean. And Irukandji syndrome causes a catecholamine surge. So the patients will get very anxious, very restless. They get pain, often lower back pain. They become very hypertensive. And when there have been deaths from this, it's been from cerebral hemorrhage, believed to be secondary due to the hypertension. So again, treatment, you want to irrigate any visible jellyfish or tentacles with seawater and neutralize it with vinegar. You need to give pain relief because they will be in a lot of pain. And a lot of the treatment just focuses on getting the blood pressure down. So we have a couple of agents that can do that. If their systolic BP goes above 160, and you think you're looking at Irukandji syndrome, you can give them some GTN. That'll obviously vasodilate. And you can also start them on a slow, or CCPs can, I think ACPs can too actually, start them on a slow infusion of magnesium sulfate over 20 minutes. And magnesium is also a smooth muscle relaxer and a vasodilator. And if you have non-tropical jellyfish, so this is blue bottles, just the other normal blue jellyfish that you see, so we're looking below Bundaberg now. The stings are painful, but they're not life-threatening. So you're going to use seawater again to wash away any tentacles. On these ones, you don't want to use vinegar for. That can actually cause more pain and worsen the injury. So just remember Bundaberg. So any jellyfish sting above Bundaberg, treat it as a serious tropical sting. So vinegar, seawater. If they've got serious things and they're getting very symptomatic, consider some box jellyfish antivenom. If they've got catecholamiine surge and no obvious real sting marks or a tiny little one, consider irukandji. And below Bundaberg, it's probably non-tropical jellyfish and it's just symptomatic management. Some other awful creatures that we have are the blue-ringed octopus and the cone snail or the cone shell. It has a neurotoxic venom. If you remember that from the land toxinology lecture, that causes paralysis. So these patients, it sounds terrible, completely conscious, completely aware, but paralyzed and unable to breathe. And I shudder to think of how many people have died fully aware of what was happening, just begging everyone around them to give them a breath, watching everyone else scratch their head, wondering why this person's just lying there. They recover fully if they're ventilated. So if you ever see these, I've never seen one, they're quite rare, but if you do ever see someone who's appears conscious but they're not breathing, by the ocean, it's possible that they've had an envenomation from one of these creatures, and all you have to do is breathe for them. Stonefish and the freshwater version bull rout are these very ugly fish that look very much like rocks, and people step on them. They have poisonous spines on their back, so when you step on it, spines go into your foot and they can break off and embed in there. Painful, very painful, but not lethal. And hot water immersion. So this picture that I've got here is probably too hot. That looks like boiling water. You want it to be pretty hot, but you don't want to cause burns for them. So as hot as they can comfortably stand. And hot water immersion is actually a great move for the majority of marine envenomations that don't require really active management, like a box jellyfish envenomation. For most marine envenomations that are causing significant pain, hot water immersion seems to be really effective. So remember for stonefish, but that's also for starfish and any other envenomations that have caused a lot of pain. Don't remove the embedded spine. You treat it like any other penetrating object and you leave it in place.